You have been dispatched to a 70-year-old gentleman who has activated his medical alarm.
Alright, so as we come into the scene, we're going to make sure that there's no dangers to myself or my offsider Lily. We're going to make sure that there's lots of room to work around the patient and that we have good access and egress. We're going to make sure that we've got our PPE, so we've got our glasses, our gloves and our boots. Is there anyone around when we arrive?
No bystanders, it's an unwitnessed arrest.
Alright, so if it was witnessed, we could ask them some patient history, some family history, and what happened prior to the event. So we can see that our patient looks quite pale today. Hey sir, can you hear me? Alright, so there's no response to voice. Can you turn the defib on for me? On manual mode at 360 joules. Sir, can you hear me? No response to pain or voice. So I'm just going to check his airways to make sure that they're clear. Airways are clear. Can you please attach the defib pads for me? So I'm not listening and feeling for 10 seconds. Cool, so there's no breathing. Can you please charge? Alright, everyone clear? That is VF shock. Alright Lily, can you please call for backup for me and then get the LMA gear ready with the towel under the head?
AT1 to comms.
Receiving, go ahead.
Confirmed R49, pressing R50 backup.
Copy that, that'll be 15 minutes.
Alright, so that shock was delivered at 45 seconds, so the next one will be at 2 minutes 45. So use a towel under the head, and can you also include the end tidal CO2? So once your airways are in, we're going to go to 30 to 2.
Yep.
And we're going to have the oxygen on 15 litres. So using this airway will just combat any hypoxia that may have caused this cardiac arrest. Awesome, just let me know when you're ready.
Cool, ready.
1, 2, 3, 4, 5. Cool, got good chest rise and fall. So do you want to just secure that for me and just let me know when you're ready?
Yep, sure thing.
Cool, so in 20 seconds I'm going to get you to push charge.
Sure thing.
Cool. Alright, do you want to 5, 4, 3, 2,
Charge.
and then breathe.
Breathe.
Right, so if we need a shock, I'm going to get you to push stop.
Yeah,
And
sure
then get onto the chest for compression. Alright, everyone clear? That is VF shock. And then straight onto the chest for compression. Thank you. Alright, so if this patient is suffering hypothermia, I don't believe that is the case because the room is quite warm. If it's acidosis or hyperkalemia, we would not be able to tell until we got to the hospital. So on the next one, I'm just going to have a listen to the lungs and I'll do the rest. Alright, so there's bilateral chest rise and fall, and I can't feel any tension, so I don't believe that it's a tension pneumothorax. Tamponade, there doesn't seem to be any direct trauma to that chest, so I'm going to cancel out that. However, it could be a cardiac tamponade, so we won't be able to tell till we get to the hospital. Cool, so on the next breath I'm going to roll the patient.
Cool.
Thrombus, because of his age, it is possible. However, again, we won't know till we get to the hospital. Just count down for me there, Lily.
26, 27, 28, 29, 30.
So there's no trauma or obvious hypovolemia. However, we can't cancel out hypovolemia due to it could be internal. Toxins, there doesn't seem to be any bottles laying around or any alcohol or capsules. The last shock was at 4 minutes 40, 2 minutes 40, so this one's going to be at 4 minutes 40. Cool, so I'm going to press charge and then come back round and you'll do the shocking if we need to. Is that alright, Lily?
Yeah.
How are you going with those chest compressions? Cool, so I'm just going to charge it in a few seconds. Alright, I'm just charging there, Lily. Okay, everyone clear? Okay, we can see that is asystole. Can you please dump that for me? And I'll get you to do the
Yeah,
hearing
sure
then.
thing.